There's a normal level of sexuality in people, and there's an abnormal level. And there's some psychiatric conditions where sexuality can be abnormal, like to extreme highs. So we can see this in bipolar disorder and paraphilic disorders, people who are a victim of sexual abuse, a condition known as Kluver-Bucy syndrome. And so the first disorder I'd like to talk about is bipolar disorder. And bipolar disorder, the episodes in which people can get hypersexual are typically in the hypomanic or manic phases. And these are when people notice like mood changes, they have increased energy, maybe they don't need as much sleep, they have a lot of creative or a lot of different ideas, maybe they're talking fast, but they get these very impulsive or risky behaviors. Some of these impulses, maybe they go on gambling sprees, or maybe they just feel this need for sexual desire, they're hypersexual, more than normal, even engage in unsafe sex practices. So people who are in a hypomanic or manic phase or have difficulty with sort of disorder, we typically treat it with mood stabilizing medications, and the mood stabilizing medications may decrease their sexual impulses. Another condition is paraphilic disorders, and these are ones where you may commonly heard of people who are like pedophilia, people who have like maybe adults that have sexual advances towards children or underage people. It could be other conditions like people exposing themselves in public, people rubbing up to strangers in public. Maybe they have a desire to put on clothing of the opposite sex. Maybe they have a desire for inanimate objects. And so these are sexual practices. There are psychiatric treatment that can help with it. A lot of times these people need to get in some sort of therapy, and there can be medications that help decrease some of these sexual urges. Like SSRIs, the medications that are commonly used for anxiety or depression, they can not only help with anxiety and depression, but there is a side effect that can decrease sexual energy or decrease libido. And so that sort of side effect may come in handy in people who suffer from paraphilic disorders. Next, I want to talk about victims of sexual abuse. And so people who have a history of sexual abuse, or maybe they're exposed to stuff of a sexual nature at a very young age. And so they themselves, in turn, may be developed a little bit differently than other people. And so they might be more sexual as a result. They may have like this emotional instability, like anger or hurt, and just these negative emotions that aren't processed properly. And so in a way of like acting out or reacting towards those negative emotions, they may be more sexual in nature. And so typically people with history of abuse or sexual trauma, they need to really get it addressed through therapy and perhaps medications as well, like the SSRIs, can decrease some of the sexual urges that they have, even help with some of the mood swings that they have, and maybe with better mood control, their sexual impulses will be less. Also, there's a condition known as Kluver-Bucy syndrome, and basically what this is a damage to the area of the brain called the amygdala that deals a lot with the fear and anger response. Injuries to the amygdala, they tend to be more inappropriate sexually. Maybe they don't have a fear of some of the repercussions, or maybe that's just kind of some of the symptoms that come with Kluver-Bucy syndrome. Those are some of the mental health conditions in which people can show hypersexual activity. Spiritually speaking, it's not just the behaviors be incorrect sexually, but it starts with the thoughts. As Christ says in Matthew 5:28, whoever looks at a woman to lust for her has already committed adultery with her in his heart. So it starts just with the thoughts and the feeling. So again, you don't want to give any thought too much validity to it, or else it can just sort of grow into a feeling and then an action and then can become a habit. So it starts with the thoughts. So try to distract yourself, reject, maybe reframe some of the thoughts one is having if it is of a sexual nature or a nature where you know it shouldn't be going or don't want it to go. So I'm not even talking about pornography as an addiction in this video. That's sort of a whole nother topic. So other medications that can help with hypersexual disorders, we talked about mood stabilizing medications and bipolar, the SSRIs, and people who suffer from sexual trauma or paraphilic disorders. There's medications that can block the sex hormones like testosterone. Typically testosterone can lead to more like aggression, more physical activity, can lead to more maybe sexual impulses, and there are medications that can block the effect of testosterone. And those types of medications can also perhaps help with sexual impulses. It's not prescribed often. I personally have only seen it prescribed in like an institutionalized psychiatric setting where people have been psychiatrically hospitalized for several years, but it could be something that helps.